So, the first part that we need to first understand is that there's that information gap out there on people understanding what role does the primary health center plays in Nigeria. So, the PHC serves as a first point of contact when it comes to treatment for citizens. So PHC is meant to attend to the immediate need or to the medical need of citizens at the grassroots level. It takes care of delivery, they go for antenatal care. So if there is an injury, there is a wound, so they go there as first point of contact. It's also supposed to serve as that that first place where citizens go to report issues of maybe disease outbreak or suspected cases of diseases in their community for proper documentation and recording.
Yes, I've been there once, but they refer me to somewhere because it's totally don't function.
Personally, I've only used it once for my son, but it's very close to us.
Oh, I just visited them last week. If you look at some of my hands now, my veins, they were looking for some of my, veins to give me injection, which they could not, maybe because of the tension and the depression of what is happening, the situation.
We need to run a test and scan. That is for my wife. They say they don't have the tools, so they refer me to somewhere else. Which, as I go there, I went the test and the scan. From there, I went to private hospital because I don't want to be wasting my time and my wife is in pain.
And they are also not so comfortable with the quality of services that they are getting. So as such, that trust begins to wind down and people don't longer talk about it. So they prefer that when there's a problem, they either go to the chemist or they live wherever they are. So imagine total number of people that goes to National Hospital, for example. So imagine people living at Kuje, driving all the way down to National Hospital just because of small things as small as maybe headache, as small as injury, or as small as antenatal care.
The charges they are charging people, it is high. If only the government will look into this and curtail all this so that the masses will benefit, because these are the primary health care which they need to assist us when we are sick quick before we go to secondary.
I collected a card. The card then I think was 700 or so. So collecting cards, then they now, we now waited for about 30 minutes to see the doctor. He prescribed drug for me and I went out to buy the drug outside.
Test that we normally do 1,000 for typhoid and fever, typhoid and malaria now goes for 2,000. Of an average man, if you look at it, it is not easy.
Even today, as I was coming out, I see one woman with her little daughter like that. They entered, the letter came out. It's like the daughter is dead, safe. I'm telling you, this morning.
At core, it remains that citizens, because of their lack of trust and the whole of mistrust and distrust that they have in primary health centers, so they've lost that touch with it. So its whole essence of having the PHC is gradually winding down, and people are no longer talking about it, or people are just no longer interested in it. So people just want to go to a secondary facility or a private facility, or they just want to go to a tertiary or secondary facility.
What they need to do is to put eye on those healthcare that we have, because people that are there, they are not doing their work at all.
If only I will pledge a request to the government. Let the government bring it down to these rural people so that they will assess it. There are sicknesses. People cannot afford 1 or 2 square meal in a day. And when you go to hospital, they will be telling you to pay 15,000, 16,000. How will someone cope when he cannot afford 1 or 2 square meal in a day? So honestly, this has been a problem that...
Services is okay, but I think they still need additional personnel to carry out their job faster. That's what I think. Because I saw a lot of people, pregnant women, different kind of women waiting for to see doctor. I think we don't have much doctors and nurses. So if we can get more, I think it's.
So those are some of the data disparities that we have, and that is why we cannot. So it will be how do I put it? So it will be ambiguous for us to say that maybe PHCs are functional or PHCs are working or some are not working. But if, for example, we say, okay, so for example, look at those communities in Niger that were hijacked by bandits, some times ago, and we saw it in the news. So have we deducted, so because those communities are not functional, perhaps the PHC has shut down, but if data still capture them that they are still functional PHCs, then it means that we'll still be using wrong data, permit me to use that word, because what we are making reference to is that, oh, PHC is it, but actually maybe in 10 local governments in Niger, bandits have already hijacked 5 of it. Meaning that like 5 PHCs are no longer functional in that side. So you have to deduct 5 from what is functional in Niger, but I don't think we are doing that. So, and look at it, just Niger is just a case. Look at it in from the southeast, the sit at home. Those days that they say sit at home, the PHCs are not functional. So you cannot even go there to access care. You cannot go there to say you want to go for treatment. If your wife is in labor, you have to stay at home. So we have to also look at, so what effect does that singular event have when it comes to our health system in Nigeria? But we don't have data that captures that. So the same thing, if we look at those states along that Lake Chad region coast, and then you say, okay, so if Boko Haram is doing this, some of these areas have been hijacked. So for example, in the community where the military are trying to tackle the Boko Haram people or the terrorists and the rest like that, and so do we still want to capture that time to say the PHC is functional? No. So there are ways that so we need to come back even to data that we have to say how many PHCs are actually functioning in Nigeria.